Right. Hi, good afternoon, everyone, and welcome to Sante Group's Lunch and Learn webinar. We're delighted to have and to be joined today by what promises to be an insightful session in partnership with Phio. We're equally pleased to be joined today by our special guest, Michael Gard, Head of Clinical Services at Phio, who brings a wealth of knowledge and experience to today's discussion. So our topic today is unlocking workplace potential and the impacts of physiotherapy on productivity. We're going to be exploring how musculoskeletal MSK issues affect not only physical health, but also mental well-being and the ripple effects it can have on performance and productivity in the workplace. Mike will be sharing some invaluable insights into proactive preventative strategies, such as workplace ergonomics, explaining how timely access to physiotherapy can actually support recovery, reduce absenteeism, and enhance overall employee well-being. So whether you're in HR, you're a business leader, or passionate about supporting healthier workplaces, we hope that today's practical takeaways will give you a deeper understanding of how physiotherapy can unlock potential and across all your teams. So let's get started. I'd like to introduce Michael, and he's going to give you a brief intro about himself.
To all of you for being here today, and a special thanks to the Sante Group for inviting me to deliver this exciting session, and to Jenna and the team for expertly coordinating everything. For those I haven't met, I'm Michael Gard, Head of Clinical at Equal. My background is in MSK Physio. I've got extensive experience across sports, private health, population health, and the public sector. Before joining Equal about 4 years ago, I led complex spinal physio and rehab teams within the NHS. At Equal, I oversee our Phio clinical services, handle clinical customer onboarding and ensure client success. So essentially, I'm all about translating clinical expertise into practical, impactful solutions for organizations like Sante Group. So today we're going to dive into that critical topic, MSK health in the workplace, and its significant impact on both employee well-being and organizational productivity. I'll be presenting for around 30 minutes, and then we'll open up for your questions. So let's see if this works. Is that moved? Lovely. Okay.
Yep.
Perfect. Great. So fostering a healthy and supportive work environment is a collective effort. That's why today's session is designed to equip you with a clear roadmap and a clear roadmap, practical insights, and proven strategies to significantly improve MSK health and well-being where you work. So my goal is to show you how boosting productivity and morale can be as simple as following a clear step-by-step process. Has that moved on?
Yes.
Lovely. Okay. To achieve that aim, I'll be covering off the following topics in today's webinar. At the bottom, the size of the MSK problem, what's driving the MSK epidemic, why does the MSK health matter to employers, a bit around physio research and some concepts, the cost of inaction for employers, some MSK prevention opportunities, early and best interventions, and unfortunately why some companies might fall short, and then discuss digital solutions such as Phio. So how big of an issue are MSK problems, and what's driving this epidemic? To set the scene, here are some stark statistics. Around a third of the UK population live with an MSK condition. Of those with long-term MSK issues, 1 in 3 never discuss this with their employer. The MSK reality is global increase over time since the 90s. The top graph you can see, taken from World Health Organization data, demonstrates this. It shows as of 2021, there are approximately 1.8 billion people suffering with MSK issues. The bottom graph demonstrates globally the years lived with disability due to certain conditions, and you'll see MSK conditions are also the biggest contributor to years lived with disability worldwide, as highlighted in the blue at the bottom of the graph. So as we all know, those suffering with MSK conditions experience common characteristics or symptoms: pain, stiffness, swelling, weakness. All of these significantly limit mobility, dexterity, leading to early retirement from work, lower levels of well-being, and reduced ability to participate in our society. And so there are a number of interconnected factors that have attributed to this increase in MSK prevalence. Top of that list is increasing population at the moment. So a population that's also aging, has an increased life expectancy, means they have more opportunity of collecting multiple different medical conditions. There's an increase in poorer lifestyle choices. We're seeing increased rates of obesity, obviously poorer diets, physical inactivity and increase in sedentary behavior. There's a general decline in socioeconomic status. This leads to overstretched healthcare services. There's workforce shortages, all of which broadens the health inequalities across marginalised groups in society that we see. The Chartered Society of Physio have recently stated that they feel that the UK needs a 7% increase in NHS physiotherapy positions each year to meet this rise in demand. And MSK conditions that are left untreated can become more complex, lead to mental health problems, or the need for surgery, as well as obviously time off from work. So why does it matter to employers? Poor MSK health has wide impact. 35.2 million workdays are lost due to ill health in Great Britain in 2022 to 23. 23.4 million workdays are lost annually due to MSK issues alone. 400,000 more people are on long-term sickness for MSK issues than before the pandemic. And chronic pain impacts mental health. 54% of those with MSK issues experience anxiety. The Chartered Institute of Personnel and Development survey recently concluded that the MSK is the largest cost to an employer on medical claims, but remains not the biggest priority. What piques interest on this slide is how significant MSK pain actually is in driving absence from work. So MSK disorders are the top 2 causes for short and long-term workplace absenteeism, yet is under-prioritized, averagely ranked 5th in organizations' health strategy. The survey highlighted that approximately 50% of organizations don't have a standalone wellbeing strategy or an end-to-end approach. Perceptions and awareness of MSK health still remain mixed, and the boxed image that you can see demonstrates the key milestones associated with MSK care in workplaces and the risks associated with inadequate interventions. You'll see that by week 6 of symptoms, disability risk increases, and beyond 12 weeks, reintegration is a real challenge without any structured re-enablement plans in place. So the next section, so some interesting physio research to discuss. So again, very interestingly, those workplace timelines that I show you have a clear overlap with the left-hand box that you're seeing here. The box depicts the known physiological healing times to MSK structures that have a clear and obvious injury. That ranges from, say, 2 weeks for muscle to 12 weeks for cartilage. So healing time, as we know, does vary though from person to person, is dependent on things such as medical conditions, mental health, nutrition, age, baseline mobility levels, etc. And the right-hand box shows the percentage of healing over time. What's clear here is pain after 12 weeks is then termed chronic. And this is a key point. Pain beyond 12 weeks is termed chronic and exists in the absence of further required tissue healing, i.e. when, further tissue damage. So when healing has finished completely. So physios play a key role in that facilitation of an individual moving through those stages of healing and preventing chronic pain. What we see here is low back pain. In 2018, within the Lancet, there were a series of 3 key papers that were published relating to lower back pain. Lower back pain is the most common MSK issue globally and was responsible for 60.1 million disability adjusted life years in 2015. That's an increase of 54% since 1990. It remains the leading cause of disability globally, and lower back pain is incredibly common. 90% of us will experience this at some point in our lives. And what's interesting is recurrent episodes are also really common. So 60% of us that get it will have repeated episodes throughout our life. It's a significant contributor to sick days, early retirement, and productivity issues. Lower back pain, like all MSK issues, is a complex condition. There's multiple contributors to both pain and the associated disability. So what are those contributors? On the left-hand side are the factors we know contribute to one's experience of pain and the associated disability. So yes, it includes biophysical factors. So these are things like tissue damage. They're definitely included, but so are psychological factors, social factors, other medical conditions, and someone's own pain processing mechanisms. And I'll expand on some of these contributors just on the right-hand side. So psychosocial factors is now seen as the biggest predictor of having long-term pain. So pain after healing should have taken place. Mental health conditions, there's strong correlations between MSK disorders and mental health issues. In fact, the odds of getting back pain in someone with depression is 50% higher than those without. And those with mental health issues display some unhelpful behaviors, such as catastrophizing or being really fearful and avoidant of movement. Then there's social factors. So those in lower socioeconomic status or have social isolation or lack of social support, that can increase the risk of chronic pain. So can things like work-related stress. Physical factors, yes, that's things like previous injuries. In the workplace, that might be repetitive movement tasks, difficult physical tasks with inadequate rest or position changes. Physical factors such as pre-existing pain conditions. If you've got pain elsewhere, you're more likely to experience chronic pain in another part of your body at some point. Certain medical conditions, age, genetics, lifestyle factors, things like smoking, lack of physical activity, poor nutrition. So what's key here is treatment for MSK pain, therefore, needs to be holistic and targeted towards all of these factors. And this is where I believe that Santé's group's cohesive wellbeing ecosystem comes into play. By offering individuals access to wellbeing benefits beyond physiotherapy, you're also organically contributing to their MSK health. So we've touched on the risk factors of getting MSK pain. The other side of that journey is then prognostic indicators. So what affects someone's recovery outcome from having an MSK issue? This systematic review was completed in primary care, so GP land settings across a number of practices over many years, and they found multiple factors affect someone's outcome or their prognosis. But key ones to draw on here are things such as pain severity and duration of pain, someone's anxiety and depression, again, mental health, their perceptions around their recovery, their own coping mechanisms and strategies, the social support structures they might have, and their movement restrictions. Again, all of these things, physios are among some of the experts to support with. Now, the keen eye in the room would have noticed that posture or desk working is neither a risk factor, a contributing factor, or a prognostic factor with MSK spinal pain. And so there is a lot of common misconception regarding the weighting of one's permanent or transient held postures. So things like scoliosis or how we sit, how we lift, how we move. So for example, the fastest elite human athlete in history lives with scoliosis, so that kind of curvature of the spine. This clearly didn't hold him back, and there was no fixes to his posture or that were able or even required. And there has been a plethora of studies globally, and to date there remains no strong, clear evidence on this subject. So in summary, there is no best posture. Movement, changing positions, staying physically active, no matter the scenario or environment setting, is important for your health. Therefore, to summarize this point, Pain commonly exists beyond expected tissue healing. Mental health status is key in getting and recovering from MSK issues. Risk factors are often multifactorial and not associated with deviations of posture, and having deviations of posture are normal. How things are framed and the language used can affect patients' understanding, their beliefs, and therefore their experiences with pain. And ultimately, that affects recovery. And to that end, what you're seeing here is the biopsychosocial model is a key consideration when trying to positively influence someone's pain and function. And this is a shift away from the old biomedical model where tissue damage or some form of misalignment was viewed as the primary cause of pain. So to include the person holistically, yes, look at the possibility of tissue causing pain, but also take a strong look at social and psychosocial factors too is absolutely critical to someone's recovery. So what's the cost to employers or the cost of inaction? So these can be split into direct or indirect costs. So direct costs are things like sick days, indirect cost, productivity, well-being, and staff retention. And the impact of these things can be far-reaching: increased absenteeism, presenteeism, HR requirements, staff turnover, legal costs, etc. So the next few slides will just illustrate this a little bit more, hopefully. So this recent large UK-based study set out to understand the impact of work-related lower body MSK pain on quality of life, so looking at mental and physical domains, and work productivity. The participants enrolled themselves, declaring themselves to have a lower limb MSK issue, and then completed an online survey. So the table shows the widespread distribution of occupations represented in the study, from healthcare to sales to IT, construction, were all included. Participants' average age were 43, 57% were female, and of those with MSK issues in the last 7 days, 1 in 5 reported being absent due to MSK issues, and 1 in 4 having reduced productivity due to their MSK issue. So interestingly, it was demonstrated that the average number of hours lost to presenteeism was 13 per week. So using the average hourly salary in the UK, this productivity loss translates to around £260 per week and over £13,000 per year per person with MSK issues. This study in 2020 sought to identify factors associated with presenteeism at work, so still being at work, but their productivity affected due to their MSK issues. These participants suffered with lower back pain and in the last 4 weeks, so that kind of early stage when it is best to catch them. The sample worked in the healthcare sector, were qualified nurses, but they worked in varied roles, so clinical inpatients, outpatients, academia, admin, etc. These participants completed validated questionnaires asking them things around their back pain intensity, their fear of moving, mental health, sleep quality, presenteeism, and work-related entities. The results showed a number of factors have a significant association with presenteeism associated with lower back pain. These key factors were pain intensity, fear of moving, mental health and depression, and sleep duration. So again, the authors concluded that these factors influence treatment effectiveness and functional recovery, and the results should encourage clinicians and occupational health staff to identify these problems prior to any intervention. The assessment of these factors at an early stage would need planning for the biopsychosocial approaches focused on the modification of psychological and lifestyle factors to improve work productivity among workers with lower back pain. So MSK prevention, an overview, the first line of defense. So unfortunately, little prevention research exists, and therefore it's difficult to suggest robustly or beyond sort of on a one person level. So most research that's done in this space really focuses on treatment for defined MSK issues rather than prevention. And prevention research is often underfunded, under-resourced. So the current guidance suggests that we should do things such as limit medication if able, use things like imaging and surgery really sparingly, but we should absolutely use the biopsychosocial approach, so education, exercise, supportive self-management, and this is again where the physios are amongst the experts. Things like the workplace ergonomics does feature in the guidance, but it has all those caveats that I've mentioned in the past, that there isn't a lot of strong evidence for it, but equally including it is still currently recommended. So the previous slide outlined some useful tools aimed at preventing MSK issues. This slide outlines what treatment for established MSK issues should focus on. And again, the research regarding treatment is far stronger. So displayed are key modifiable health outcomes that matter most to people and are supported by research as to their importance to influence recovery for those with MSK issues. So the degree of which an individual is affected varies, and therefore offering should be shifted to these in a personalized way as possible. So the key facets of holistic treatment worth addressing, therefore, are things such as someone's pain, addressing their mobility, their physical activity, sleep, social interaction, their work and daily routine, fostering independence as best as possible, increasing their understanding of their condition, their treatment, their prognosis, all of which aim to increase their confidence to manage their symptoms, support with kind of daily activities, washing, dressing, fatigue, and just their overall impact. Treatments, therefore, should be targeted towards these elements. So in the pain modifying, it's education, reassurance, yes, the correct pain medication, supporting someone with progressive movement, lifestyle factors. So physical activity is by far the most important lifestyle factor to influence pain severity. That's demonstrated in multiple very large cohort studies. That's then followed by things such as smoking cessation, diet, sleep. So practical things like walking groups. It's been shown that completing over 4,000 steps per day significantly reduces all-cause mortality, but also is really important for pain. Again, physiotherapy can help if needed with education around lifestyle, but fundamentally exercise needs to be fun. It needs to be practical. So in a location, at a time, it's affordable. People are doing the things they prefer to do, and it's progressively built up. It needs to be really meaningful to the person and important, and that's where personalization comes in. Sleep, again, is a lifestyle factor. So education on sleep hygiene, mobility, walking aids, or gradual exposure and building up to doing more if there's been an injury. And then crucially around mental health is education and understanding. So through psychology or support with mental health or counselling, physios often deploy things like cognitive behavioural therapy or pain science education. All of these are aimed to kind of improve someone's self-efficacy, their ability and independence to self-manage. So we're now just considering the best sort of MSK treatments and why companies might fall short. So tangible employer strategies could be things such as on-site or private physiotherapy. So again, personalized care, talking about that biopsychosocial approach. And again, exercise programs useful. Early intervention programs, so establishing protocols of early reporting. So going back to that first slide of, there's a whole proportion, a third of people with chronic pain never mention that to an employer. So creating protocols where early reporting of MSK symptoms and prompt access to treatment is crucial. Promoting a culture of proactive care, encouraging employees to seek help before the problems escalate. Mental health integration, so recognizing the link between mental health and physical health, and provide resources for stress management and resource education and awareness campaigns. So conduct workshops, training sessions on MSK prevention and self-care, provide those educational materials, movement breaks, on-site exercise walking groups, provide signposting tools, where you can signpost people off to MSK tools and support. But two real crucial ones towards kind of innovative approaches are data-driven strategies. So tracking MSK-related absenteeism and presenteeism data to identify trends and area for improvement is key, and using that data to evaluate the effectiveness of any interventions and adjust strategies accordingly will continue to see that improvement. And that's where digital MSK triage and self-management tools come in. By implementing these sorts of platforms, they support with early symptom assessment, triage, guiding employees to appropriate care, and they offer that kind of supported educational components through apps that they're accessing. And unfortunately, not all companies offer MSK programs, and there are a number of root causes as to why companies might struggle to implement these programs. I guess first is that insufficient data piece. So, knowing the size and the impact of MSK problems, if that's unknown, that's going to be the first challenge. Data on the effectiveness of any MSK treatments or solutions might also be unknown. If companies are looking to compare different solutions out there, that's a challenge. Sometimes there's, the comparison of these solutions is often not feasible, inhibits the informed decision makers within leadership or HR, whoever that's to be. There are now a growing number, there's an abundance of MSK solutions, so it's hard to know what's best, or even the ROI is sometimes unknown. So budget constraints, can also feed into that. So many companies have limited budgets, they might have competing priorities, mental health, women's health, and the cost of traditional care is already high. We're seeing, averagely it's around £75 for private physio in the UK. And that's where digital solutions come in. So this is the home straight now, guys. So meet Phio, a tool used by the Santé Group. Phio is a suite of digital MSK products. Phio Access is a digital triage tool that assesses an individual's MSK concern and offers them the most appropriate signpost outcome immediately. Phio Engage, a self-management app that can support users eligible for self-management to recover at home or in the most convenient location, but together through the power of data analytics, Phio can track efficiency and other patient insights. Phio Access is the digital tool that identifies the right care within around 25 minutes of reporting an injury, ensures around a 95% triage accuracy compared to physios, and helps employers access care anytime, anywhere. So via the Santé Group, patients are a few clicks away from beginning their Phio assessment. Here is an overview of the user journey for Phio Access. They begin their journey in a chatbot style assessment where Phio will ask questions around their concerns. We use both text, multiple choices, questions, images, videos throughout the assessment to collect the information. And at the end, users will receive an automated outcome immediately. Our internal clinicians review 100% of those cases, have the ability to either kind of up modify or down modify the outcome based on any additional information. And on the right-hand side, you'll see some of the examples of the outcomes available via Phio. With Santé, patients will either be signposted to urgent care, 111, GP, face-to-face physio, or into self-management. And self-management is Phio Engage. And this provides a personalized exercise program. It offers consistent support with Phio's team of physios in the background, so you can chat to us via the chat tool. And our specialist physios offer the bespoke educational advice to ensure that biopsychosocial approach remains considered. It has the ability to track those key things such as pain, steps, sleep, recovery, and progress. And it's been shown to reduce MSK pain by around 40% in 8 weeks. Our face-to-face provider offers around 2,000 clinics and there's around 4,000 physios that provide that coverage nationwide. And if a patient receives a face-to-face outcome, then they will offer their postcode to our provider, and they will identify the closest clinic and continue to book an appointment from there. Our SLA for first appointment availability is less than 24 hours after the assessment, and the current average distance to travel for an appointment is 4.2 miles, I believe. Some impact. Phio has a 93% completion rate of assessments, with 350,000 assessments completed to date, and the average net promoter score of 86, which is excellent. Phio Engage delivers significant reduction in pain and improvements in well-being, wellness, sleep, social, and work engagement. So it truly unlocks and delivers on that biopsychosocial approach to care. In 2024, we're proud to say that around 160,000 exercise sessions were completed and 47,000 personalized message delivered by the Phio team. So, in summary, the MSK issues are rising and are a costly burden. Managing MSK is a business priority, not just a health issue. Investing in prevention and early intervention reduces long-term costs. Digital solutions that are personalized bridge the gap between demand, access to care, and cost effectiveness. Just before I hand back over to Jenna for the Q&A, if you'd like to know more about this subject, please scan the QR code on your screens. It will take you to a white paper on this subject, which Equal conducted recently. So to conclude, thank you all very much for your time and joining today, and I look forward to your questions.
Thank you very much. That was really, really heavy with facts and really insightful. I will say this, I was adjusting my posture quite a bit when we were talking. We've had quite an influx with regards to statements, comments, lots of people saying it's really empowering to have sort of a base knowledge of how other businesses are really either looking at different solutions and all of the solutions that are available, and some fantastic comments, really interesting, great facts. Thank you, super interesting, really impactful statements on MSK. So one question, I actually wanted to go back personally, if you don't mind. You mentioned that the MSK issues you've seen sort of post-pandemic have been on the increase. Is there a particular reason why you've seen such a spike in issues post-pandemic?
Yeah, I think that's a really, really good question. I think there's certainly, as ever, multiple factors, and I think there's multiple factors. Where do I start? I think first of all, we know that services shut down, reprioritized, and it's the weightiness off the back of that, and there's still a recovery in NHS land specifically for that, the backlog that it's created. I think people's lifestyle choices and their access to care and their access to healthier lifestyles and all those determinants that we spoke about in the biopsychosocial were drastically affected. If we're talking about mental health, if we're talking about sleep, diet, exercise, social interaction, you could go through and tick all of those. Nearly every single one of those were affected. And then there's the known, but certainly we're becoming more known, entities of how COVID has affected people and people's physiology and the interaction play that it has with MSK care. I worked within a large London NHS trust during COVID, and the immediate caseload that came through COVID and post-COVID for a while, and the complexity really increased. So we were seeing people turn up with multiple pain sites, multiple issues, and we see a real shift in the types of patients that we see. So I think really it's probably the multiple things, a shift in healthcare provisions, and the big shift in change in everyone's determinants of health. But then equally, there's the financial downturn has affected that. So people's ability to have gym memberships or eat healthier and being more stressed, etc., was all changed in the sort of landscape that's followed that time period, I think.
Yeah, absolutely. And I think, as you said, knowledge is so important, and knowledge of people's injuries, the location of how to help support themselves. And I think, as you've said before, that lack of opportunity that people had during that time has then resulted. I think you said it was a 7% increase on physio sessions are needed, or access to physiotherapy support in the UK currently now, which again, the financial burden on that in terms of an NHS versus then, I'd say, an ROI for a company. Do you find that there's an element of overwhelm for businesses when there are solutions out there and or opportunities to provide things for staff? There's a bit of an overwhelm of what avenue to go down.
I think so, yeah, and I think it feeds into some of the survey stuff that I mentioned, just around the clear policies and strategies of businesses, and there are conflicting priorities, and often MSK does fall off that list. And I think sometimes it's the underreporting. It's fairly normal to have musculoskeletal pain and aches and pains, but I think, you know, it's the underreporting issue, and that feeds into businesses then knowing how much it's impacting their service. So I think if you have that unknown infiltrated into the business, then that sets you up to not necessarily see the priority. I think that's one. And then touched on as well, just around the different opportunities that are out there. So, you know, there are the local strategies that you could employ first, but then also it's understanding the impact of those and the metrics against them. If they are just employed internally without external expertise, then perhaps it doesn't have the value either. And so having some expertise delivered, I think, gives the value and therefore hopefully have the impact. So I think, I think it's difficult to know the exact solutions that fit your business.
Yeah,
it's understanding the size of it and then seeking the best solutions, I think.
Yeah, we've actually had a couple of comments come in, actually, one about employees providing this. Someone's asked, is there a legal obligation to provide MSK support, physiotherapy services to accommodate employee health?
Yeah, I think it's a good question. Employers have an obligation to look after their staff at the end of the day, employer liability, etc. Plus, it's in their interest to retain and motivate staff. I think is the best way to look at that.
Excellent. Well, I think from our perspective, it's been really, really insightful. And I do appreciate the stats and things. I know we put the QR code up right at the end as well, but if that's something you can share with me, we've got a number of people asking for links for things, specifically, again, around the heat map that you shared as well. If that can be made available, we can go ahead and I can add that back to stage, and then people can scan, etc. But yeah, any final thoughts from yourself, Michael, before we wrap up?
No, that's me. Thank you again for the invite. It's been a real pleasure. So thank you.
Likewise, and thank you very much. And to all the inquiries that we've had with regards to access to some of the slides, information, advice and guidance, we will be following up. And of course, we will have this as a recording available as well for those who missed it. So thanks very much for joining us, and we will see you on the next Lunch and Learn. Thank you.
Cheers, everyone.
Take care. Bye. Bye.